Hello to everybody and welcome to this Women in Leadership Special Interest Group webinar. You may not have realized it, but today is International Equal Pay Day, so it's a great day to have chosen. I will put a link to some interesting resources and events in the chat if you would like to find out a bit more about the campaign. But as many of you know, the Women in Leadership Special Interest Group focuses on gender equity and specifically the leaky pipelines for women in accessing C-suite and board level roles in healthcare. But today we're going to look a little bit more broadly at another category of bias that has come up in many conversations we've had about workforce management within the IHF network. So that's bias related to age and generation. So we have some fantastic high-level experts here just waiting to get started with the discussion. But first, it's my very great pleasure to introduce you to the wonderful Dr. Manshwa Chizale Mebotja, a member of the SIG Steering Committee, in addition to her very many other roles. And Manshwa will be leading today's discussion. Just as a reminder, this will be recorded and we'll put it out as a recorded webinar through the IHF website, so people on other time zones can also benefit. So Manshwa, over to you, please.
Yeah, thank you so much, Ilona, and good morning, good afternoon, or good evening, depending where you are. And welcome to the special webinar where we'll be discussing a very important topic, looking at tackling bias amongst healthcare teams with looking at intergenerational workforce. And as Ilona has said, we've got a vast different experts from different backgrounds with immense expertise and experience on the topic, and would really all be sitting here and listening. And to all the attendees of the webinar, you can use the chat box. If you have any questions or any thoughts, you can always use the chat box to send the message, and we'll address all the comments sent in the chat box. And just to introduce our experts, we have Professor Megan. Professor Megan is a founder and an owner of the genintelligence.org and is an author of a book, The Gen Intelligence, A Revolutionary Approach to Leading an Intergenerational Workforce. Welcome, Prof. Megan, to our panel. And we also have Ms. Erin. Erin is a founder and a director of the Age-Friendly Design Thinking. Welcome, Erin, in our panel. And we also have Dr. Miguel. Miguel is the CEO of a hospital in Portugal. It's a local health unit that is actually based between two rivers. If you joined our webinar just before we started, he was just telling us about the location of the hospital. And to our panelists, welcome to this webinar. We are looking forward to you sharing your expertise and sharing the knowledge with us. And I think before we start, I would just want to ask you just an opening question, just to get to understand where your thoughts are and where your thinking and experience are. I'll just start with you, Megan, if you don't mind. Megan, if you can just tell us, what does age-related bias mean to you as an individual, and why is it an important topic for hospital leaders to consider?
I think anytime we're talking about age-related bias, we are really missing out on the potential opportunities that having an age-diverse workforce can bring us. So we tend to look at those tensions as a threat because they are quite challenging and frustrating. But research would show that if we manage and lead those well and create, as we're here to talk about today, age-inclusive cultures, age diversity can actually be a great source of innovation, engagement, retention for our talent. So I think when we talk about age bias, we're talking about any part really aren't leveraging that aspect of our identity as well as we could.
All right. Okay, we lost you a bit there, Megan, but I think I got the jigs of what you were saying. I'll just allow Erin to answer the same question. What does age-related bias mean to you, Erin? And why is it an important topic amongst hospital leaders?
Thank you. And thanks for inviting me to the panel today. I'm excited to be speaking to this group and with this, all the experts on the panel too. This is a wonderful opportunity. And I would say I use the word ageism and age bias interchangeably. And so I use the World Health Organization's definition of ageism, and I'm going to read it so that I don't mess it up. And the World Health Organization says that ageism refers to stereotypes, which is how we think, prejudice, which is how we feel, and discrimination, which is how we act towards others or ourselves, based specifically and exclusively on age. And I was giving a presentation yesterday about ageism in Colorado, where I live. And I tell people before I speak about this that bias is not good or bad, it just is. We have a lot of biases as humans. For example, I am biased against walking into a dark cave in the middle of the woods in the middle of the night where a bear might be sleeping because I have this bias that there might be a bear in there and it might not be happy to see me. And so these biases, it's just how our brains work. It's how we construct the world to be safe. So when we're thinking about ageism and how it shows up in hospital systems, we need to know what it is so that we can identify it and see if it's creating a barrier or if it's helpful for us. We all have biases, and what I like about talking about ageism is that it's something we haven't spoken about a lot recently. So I don't think that we see where it shows up as a barrier. And that's
Yeah.
why I'm excited to talk about it in hospital settings because I personally believe it's a barrier to success for healthcare and for workforce in the healthcare system.
Yeah. Thank you so much, Erin, for that overview on your
Yeah.
understanding. And I'll move to Miguel. Miguel, I'll ask you the same question. What does age-based bias mean to you as Miguel, and why is it an important topic to actually amongst the hospital leaders?
Well, we live in a world that is more and more cataloging people by groups. You are the group of the Afro Americans and the Asia Americans, and all the groups. And one of the and these categorizations of the groups creates some bias because people say, "Oh, this is because you are from this group." You are not so well because you are because of that group. So this the idea that society now is putting everybody in boxes is creating these tensions in the organizations and even in the society as a whole. The age is also one kind of box. So there are many kinds of box, and the age is also one of the boxes that exists to make these catalogs. And the good thing is that the world is much better with a lots of boxes. If there was only one box, it would be too much boring. The world is much better with a lot of boxes. The difficulty thing is how to manage the society and our organizations with different boxes in a way that it is stable and it creates a nice environment, a productive environment, a respectful environment, a motivational environment. This is the issue and this is the question. So age is one of the boxes, and there are some tensions between the old ones, between the youngest ones, even between the youngest, the top youngsters and the not so young as but still young. And this creates possibilities if we don't manage this properly in societies and in our organizations. It creates the possibility that someone is not respected is because they can be subject to some jokes, some assumptions that are not correct, and this will uh, not allow people to release all our capacity, all their capacity, and this is and our focus in, and this is important because in healthcare organizations, I say this many times. Our industry comparing to other industries is much different because all we can get to our patients is a service. A service is something that is delivered only by people. We don't deliver, we don't we deliver our service by people. So we need people motivated, engaged, and this can only be possible if we have everybody connected, everybody working in an environment of motivation and innovation and sharing knowledge and taking advantage of each one's abilities. And the youngest are better in certain things, the oldest are better in other things. And if they connect, if they cooperate, if they speak to each other, they communicate properly, the outcome it's much better. So this is our challenge.
Yeah, yeah, I actually support that. We unfortunately, healthcare is a very complex system. With all these complexities that we face in the healthcare environment, bringing different individuals definitely will bring that different diversity, different thoughts, ways of thinking, and ways of doing things that could actually improve. Because essentially, the healthcare system, the outcome is to get the best outcomes in terms of our patients and saving lives. That's basically the business of what
Yeah.
healthcare is all about.
Yes.
Thank you so much for just giving me that background. I just want to just go back to Erin again. Erin, I just want to check with you, what are some of the consequences of this age-related bias within a team, in a team setup? And how can generalization or generalism help or hinder the effective leadership in a team where there's different generations?
Thank you. I would say that going back to the idea that bias is neither good or bad, it just is. We have to look at it and see what the impact is when it shows up in a space. And when we think about consequences of age-related bias within a team, within any team, in the United States alone, age-related bias in the workforce is an $850 billion suck on the economy. Miguel was saying that we're not including older adults in the workforce. We're not helping people to maximize their potential in the workforce. It is $850 billion loss to our economy. And so, there are a lot of consequences to ageism when we look at it closely and we start to slice it up. And there are lots of things like when people aren't included in the workforce, it's not good for their mental health. When they're not included in the workforce, they have less agency in their own lives. They don't save as well for retirement. They require more social services when they're older. They may not be able to afford a place to live because they haven't had the same economic opportunities. There's all of these things, a million ways that we could talk about it. And it's $850 billion, which in the current moment, I think is a really good argument for policy about why we should have better inclusion of age within any team, and especially in healthcare. And the other question that you had asked was, how can generationalism help or hinder leadership? So generally, generationalism is this idea that we can be placed into generations, and research does not support the idea that generations are truly a good way to divide people. The thing that makes us the most similar, more than our age, more than our gender, more than anything else, is the zip code that we're born in. It's the idea of social determinants of health. So we have more in common with people born in our neighborhood than we do with people born in the same year. And what makes it seem like generations exist, there's a lot of forces, but one of them is that if you look at a team, that team is probably built of people who were born in similar areas, had the same educational opportunities, come from the same kinds of families. And so then within a workforce, it seems like generations are the thing. But we're missing out on all the other things that bring us together similarly into these places. So again, going back to what Miguel said, we're missing the opportunity to elevate everybody's potential to do their best. If we say, oh, well, you're 50 now, so you probably can't use AI. Like people in their 50s built the internet, they built AI, they laid the foundation for technology. And so we have to be able to zoom in and zoom out and say, yes, you are this age, but what other things do you have that you can bring to the table? And it takes intention in leadership to really look in and coach everybody to their greatest potential, no matter how old they are.
Sure. Yeah. All right, thank you so much. I think you raised a very important concept there when you spoke about the loss to the economy, the impact or the consequence that having this intergenerational workforce, the bias around it, how it affects the economy. I don't think most of us think about it in that way. And yeah, I'll just move back to Miguel. Miguel, do you have any experience of obviously working in a hospital environment? Do you have any experience of differences in age-based expectations across the workplace? That you have, for example, like how these teams affect collaboration within a team, this bias itself, how it affects collaboration between the team. So based on your experience as a leader in a hospital setting.
Yeah, there are many differences according to the expectations of different age groups towards life and towards work. I say this many times. The generation from my parents, my father, he says proudly that in the day that I was born, he was working. If someone nowadays says that he's working, a man says that he's working in the day his wife was having a kid, I think he will miss the opportunity of getting the job. If he says so in an interview for a job, someone will say, "No, you are not human. So you are not a human person. You are not sensitive enough to be among our team. So please, we don't want you." So this is the big shock in the expectations and the way people face life. And in our organizations, where, for instance, this culture of being long periods in the workplace, like the old generations, they had much this culture, at least here in Portugal. With the difference with the new generations that they work, how much should I work? It's 8 hours, okay. At 8 hours, 0 minutes, I'm away. Don't count on me. So this is a different approach, and this is the expectations people have, and it's very legitimate. So, but this we have to know how to live with this and to deal with this in a way that it doesn't create tension, because it's people rights to have it to work like this, and in fact, it can even be much better. Other question is the way of communication in the organizations, because in long time ago, if you say I'm the boss, so if you say the boss, and if I say something, everybody will follow because it was said by the boss. Nowadays, if you are the CEO and you want to give some order, you have to explain to people, because if they don't understand, it's not because you are a boss that you can expect people to do so. And so this is very important for the leadership in the organizations, for the higher leadership, the middle term leadership, to have the importance of communication and the transparency, because this can be very dysfunctional if you don't do it. And in healthcare organizations, where we have the autonomy of the providers, so our staff, they have autonomy, so they work autonomous. They can do according to their experience and the knowledge they have. So if we cannot align them just by giving orders, we can align them if we involve them on the processes. And this new mentality, or the mentality of new people, of the younger people, is changing a lot this. And in fact, the results are much better if we can implement this kind of communication and the sense of hierarchy, where everybody has a role and has a word to say.
Definitely. Everyone has a word and a role despite their age. I like
Yeah,
that.
yeah.
Thank you so much, Miguel. Just back to Megan. Megan, what are some of the positives of working in this intergenerational team? Working in a team where there's different age groups. What are some of the benefits? Obviously, when it's well managed.
So I think I'll bring in here something to add on to what Erin said, which I agree with. I think, I have a maybe slightly different addition in that I think anytime we say, generations are not valid or we want to step away from generations, I think what we're really saying is don't stereotype people based on their generation. People don't fit in a box. There's many layers to their identity. And anytime you say all Gen Zs want to be managed this way, you're wrong because that's a very complex group of people. I think what we have to be careful about is that, generation, like any other box that we use in our society, can be used in a really important way when we view it simply as a lens for understanding, as a starting place. So I like to say, a generation is the beginning of the conversation. It shouldn't be the end of the conversation. So there's many layers of your identity that interact with your generation that need to be taken into account. But what I don't want us to lose, whether we use generation or we simply just consider the time in which someone has gone through their career, is there is a very unique and interesting kind of unique expertise and value that comes with age and generation. And positives, as related to the question you asked me, I think is when you can value that and you use it as complementary to perhaps the way someone else is seeing it as a benefit of their lived experience. So one of my favorite takeaways from research is, as Erin said, we all have very similar intrinsic needs in the workplace, whether we're 17 or 77, and most academic research would confirm there are not very many generational differences when it comes to needs or values. The problem is most of it stops there. So then when we go to work and we feel like, but I feel like something's different when I work with someone a lot older or younger. If there aren't generational differences, then what am I experiencing? And so I think one of the most valuable things I could add to this discussion is our intrinsic needs and values, research would say, are very, very similar. But what we're feeling is that the norms we've learned about how we pursue those values can have a generational element to them. So, what does it mean to connect with someone, and what's the correct way to do that, quote unquote, might be very much influenced by whether I grew up at the time I did, where you had 2 or 3 options to connect with people, or my son is 20, he has 15 different channels that he regularly uses. And so our need for connection is the same, but the norm and belief we have about how you fulfill or pursue that can look really different. So that leads to the answer I would give to the question of what are the positives, is that's a diversity of thought and experience we don't want to overlook. We don't want to generalize by any means. We don't want to stereotype. We don't want to shame. We don't want to judge that your experience is different than mine, so therefore it's wrong. I would push people to instead say, your experience might be different than mine. That's fascinating. Can you share it with me? Maybe mine plus yours could help us solve this problem. And so I think the positives are when we're willing to step back from judgment and say, of course, it's valid that your view on mental health in the workplace is a little different than mine because we grew up, life course theory is what we would call that. We grew up at a different period of time. We had different tools, we had different experiences. One of my favorite research findings is that Gen X, the people in their 50s that did, as Erin said, built the internet, our attitudes about AI are a little more trusting and less threatened than younger people, largely because of our life stage, but also because we survived the invention of the internet. So we're a little bit more willing to kind of roll with AI because we figured that out, right? So that's something that a millennial or a Gen Z might not have experienced because they were for a very long time digital natives, and they are not digital natives to AI really. And so I think the positivity is when you can step back, and my work is all about having smarter intergenerational conversations. So don't stereotype, but think, wow, I bet you might see this differently than me in a way that could be really important. How would you approach this? Or can you help me understand why you seem to be thinking about this in a different way than me? We have all of this potential based on our age-based experience that we could tap into in a really productive way. So I agree with Erin. I think though we don't want to be the age version of colorblind and say, well, it doesn't matter at all. It could matter in a really valuable, beneficial way if we can create the trust and the climates for that to occur.
True. Thank you so much, Megan. I think our panelists just showed us the different consequences of actually using this amongst our teams in healthcare settings. And then we also looked at the positives, and there's so much positives. There's no doubt that there's so much positives in having a workforce that has a different age in a team. But I want us to move to coming up with how do we then bridge this gap? We already have identified these challenges, and we want to know how do we bridge the gap? And I just want to check with you, Miguel. What are some of the approaches or examples, or practical examples that you could give us in terms of how to manage and retain an age-diverse workforce in a hospital setting?
Yeah, this is the challenge, is to do it.
Yeah.
And just to stress something that Megan just said, that this the question of communication. How do
Yeah.
you communicate with people? That makes completely the difference, and can involve people. And this is really, really interesting what Megan just said. So, what things that we are doing in trying to fill this bias, or to work to overcome this bias.
Mm,
First is to see what some age groups are better than others and to make them complement them. For instance, investigation. These young doctors are more committed in investigations. They participate in PhD programs. They are doing investigation in certain disease, etc. Part because this is obligatory for their to receive their approval as specialists. And during this period, when they are doing some investigation, what we are always trying is to involve older doctors from the same departments that are not so much aware or not so much dedicated to investigation to involve in the same projects. And if they cooperate in these investigation programs and projects, this is making them more confident about investigation, because the older ones, some of them, they stopped investigating, they focus too much on providing and not so much on this and this part. And this mixture is doing is we are having a good success, taking some older staff, doctors, to more investigation programs and projects. So this is something, and this is also, and also the young, they also like to have this approach of the experience of the oldest ones. This is very a good experience that we are having. Other thing is we are creating, and we created 3 years ago, a program of flexible training, giving to people who present us some investigation programs the possibility of having some of their work time dedicated to the investigation. And for younger doctors and nurses, this is very valuable. They value very much this. Each time we are now increasing even the number of kind of scholarship we are giving to this staff members, and this is creating motivation on the younger generations. Other thing that we also did is, for instance, sometimes we have some project, special project, imagine for cardiovascular disease, and we create a group to work some special project. All these groups are groups with doctors, nurses, and other healthcare staff. But in all groups, we always try to find older people and younger people and to mix them. And this mixture is very, very useful, because you see, for instance, this question of managing the AI tools and more digital tools, the youngest, they push the projects they are really good to leverage the projects. The old ones with the experience, they bring their experience, and this mixture is also very important. And we realize that when we put it, the adherence of the teams of the staff is better. So
Yeah,
because
definitely.
all of them are involved and all of them explain to the ones that are in the same box as them. You see, so we put all the box
Yeah,
cooperating.
true.
So this
Yeah, no,
helps.
that makes sense.
This helps a lot. And other thing that we did, and this was very important. About 5 years ago, due to some new laws in Portugal, we had uh, to choose new directors for all the departments. So all departments we had to choose new directors. And when choosing these directors, we thought a little bit earlier, and we decided that we want someone to have a cooperative profile. So this was the one of the main issues. And this cooperative profile that we were looking for new directors was really changing. It changed a lot in the organization because we found we had some departments that were not cooperating with the next door department because the leaders were very much focused on themselves, on their goals, on their teams, and not willing to connect with the others and to make concessions and to make agreements and to cooperate. Now,
Mhm.
this new generation of directors that we have in all departments, they have a much cooperative attitude, also between the departments and also between inside their own departments, looking at all the people of the departments, because in all departments there are this generational bias, but also other bias, because some of them are from the medical school from the north, the other are from the medical school of the south, and there are some shocks between medical schools. There are, so you have to lower these tensions and to make a way that nobody feels that is suffering any damage because is older or younger or from the medical school A or B. So this cooperative leadership profile was really, really, really important. And finally, I would say the last one, which is our when someone wants to make some proposal to us, we just accept that they propose to the board with the signature of everybody which is involved. You say, for instance, you say, I want to increase the space of my department, and next door department is very nice for me. Okay, bring me the proposal with the signature of your next neighbor next doors. So when you two are you agree, so when you have the agreement between yourselves, this can come to us, because many times people are uh, pre- doing proposals that involve third parts, not thinking on their reactions. And this is really important because this makes people speak between themselves
No, thank you.
before, and this communication, we come again to the communication.
No, thank you so much. I think you gave us such practical, good examples, and most of those examples are just showing how the importance of collaborating the
Yeah.
different age groups. And thank you so much, Miguel, for sharing those experiences. Very interesting experiences, I must say. Can I just quickly move to Erin? Erin, how can hospitals and tech design support an age diverse workforce?
Yes. So when we're thinking about how we design our systems to support age inclusion, I lean on age-friendly design thinking. And for anybody who is familiar with design thinking in general, it's a pretty standard process, and there are several organizations around the world that are educating and training on design thinking. It's a process of co-designing with empathy with the people that you're trying to serve, and then going down the line, getting an idea of what you're going to create, creating that thing, testing your assumptions on whether or not it worked out, and then you go back to the beginning and you ask the people that you designed with if you got it right. We never get it right the first time. There's always room for improvement, and then you continue to iterate on what you've created. So design thinking, when we talk about designing for systems and processes, there are a couple different standards of designing well for everyone. And there's universal design, human-centered design. We talk about user-focused, and a way to think about designing something so everybody can use it, like a door handle, right? We want door handles to work for everybody, no matter their strength, no matter their size, no matter their age. But because we have not yet begun to talk about ageism, because we are really blind to ageism within ourselves and within systems, still at this point, it's a blind spot for us. When we believe we have designed well for everyone, oftentimes we have not designed well for age. And so I like to point people who are seeking for age specific design to think about age-friendly design thinking, which is it's a more complicated process than this. It's not super complicated, but the easiest way to say it is that it is design thinking with an age-aware lens. So before we start thinking about how to serve an age-diverse workforce, we need to, what I call, peel the onion of ageism. And that starts with looking inside of ourselves to see what we believe about our own age, what we believe about the age of others, what we believe about how age interacts with institutions such as healthcare systems. And again, I refer to the World Health Organization always. They are a wonderful touch point of research and evidence-based change-making practices. It's a good resource for people all over the world. No matter where you live, you can have access to really good research resources, tools in your language, in the language of the people living in your communities. And the three things that the World Health Organization has said are impactful for changing age bias and being a good change maker in your system and in yourself are, number one, educational activities. So, all right, we're doing it today here. Step one. Good job, everybody. The second one is influencing policy and law. And so I encourage everybody here to think about how you interact with your local policymakers. What are you doing at the grassroots level in your hometown? What are you doing at the state level? What are you doing at the federal level if you have that kind of time? Make sure that you're giving your voice to policy. It is a slow bus. It moves very slow. We meet in a windowless basement in my hometown, which is not the most exciting place to be, but it's a really good place to plant these seeds of change making for age. And the third thing is intergenerational interventions. And intergenerational and multi-generational are not the same. Multi-generational is when you just kind of have people of different generations showing up. We all work in multi-generational workforces. We don't all work in intergenerational teams because intergenerational is intention. It's exactly what Megan was saying. I loved how you said that, Megan. And I love these two different perspectives that we're bringing, because we can't just focus exclusively on age, but we also can't pretend like it doesn't matter at all. And so when we sit down together and we say, yeah, what is a little bit difficult and could it have something to do with our age? And we look at it together and we create together with intention, that makes it intergenerational. And that is very impactful in creating age-friendly, productive workforces where people feel that their voices are heard and they're happy at work and we're all getting more done together.
Right. Wow, very interesting concept, the age-specific design thinking. I think very interesting. And the documents that you've just told us about, the WHO, I will definitely have a look at that and just get to understand these three. But the three, amongst the three steps that you mentioned, one was actually on policies. And that brings me to my question for you, Megan, around policies. What are the are there any specific policies that are unintentionally disadvantaging certain age groups? in the workplace?
So I'll answer this in two pieces. I think one, when we talk about formal policy, so there's research that's really interesting on how people strategy, so specifically HR practices that are perceived by employees as being age inclusive, have really interesting effects on all of these positive outcomes we've been talking about: engagement, retention, performance across ages. We're not just talking about older people, we're talking about any age. And so those fall into broad categories, things like, does everyone in your organization, regardless of age, feel like they have an opportunity to continue to learn and develop? So we talk a lot about the youngest and the oldest in the workplace, but just about, I'm doing a quick scan. All of us on this panel are somewhere in between, I think, probably. And so we don't talk a lot about, when was the last time that someone 48, that's my age, was asked what sort of development opportunities they might be interested in. And so, anything that has to do with, do I feel like my age is going to prevent me from getting a job, being developed, and that someone's going to be interested in investing in me, or keeping a job, we have a problem. So if we go back to policy, first, let's look at recruitment. Age inclusive HR policies around recruitment would be, let's take a close look and do an audit on our job postings. And this might be, of course, we've all heard the language of, seeking energetic, coded language for, we want someone young. There's also coded language or not so coded language around wanting someone older, seasoned or experienced, or even something I'm seeing a lot because I work with young people, we do have a lot of artifacts in our job postings that say 3 to 5 years, 5 to 8 years experience required. And I always like to challenge my clients and say, can you tell me why? Can you help me understand why you're asking for that? And if they readily say, yes, we can, this is what we found, this is why this is still important in any direction, then great. You should keep that. That sounds very valid. If they say, I don't know, we've always just required 5 to 8 years of experience, is today in 2025 that still relevant or serving you, or is that preventing you from tapping into a more age diverse talent pool? So there's that, right? Or is it going to get you sued? Would be obviously a big issue as well. I've raised, the flag around how AI is potentially going to make this systemic. So if I'm teaching my AI to filter out resumes that don't have certain words or terms, or, then am I building in systemic age bias in any direction? So those are things we need to be looking at right now. I think anything having to do with policies around, we require someone to be in a particular role for a set period of time before they can advance. Again, I would ask, can you tell me more about that? We know younger people, and it gets shamed and judged as they're impatient and don't want to put in the work, but there's a lot more to it than that. The era we're in right now, what used to take 3 years to learn may or may not take 3 years to learn. And so by having very rigid rules around advancement, we are losing a lot of our particularly younger talent. So what are your rules on development and progress? How do you give feedback? Things like that. What are the feedback and frequent check-ins versus, sort of the once a year annual reviews? All of those formal HR strategies have been shown to really make a difference in the perception of age-friendly climates, which also impact some other important things. One we haven't mentioned a lot here, but very important, especially in healthcare, is the willingness to transfer knowledge, older to younger or younger to older. So the more age-friendly I perceive my organization to be in terms of their policies, the more likely I'm going to be to transfer my knowledge to someone else who could use it of a different age. That's really important. And then the last thing I'll say on the more informal side is being open to understanding why certain policies or procedures might create a barrier for a particular age group that we didn't think about at the time we created it, or that wasn't true at that time. So this is where really, the metaphor I've been using a lot that I'll throw in here is which of the walls in your organization are what we would call load bearing, which ones are holding up your house, and which ones are optional.
Yeah.
And that's a discussion. I can't tell anyone that. That's an internal discussion, but you have to be willing to ask the question. Like, is this something we need to make sure we have in place forever? Because without it, we are not who we are. And if so, let's explain to everyone why it's there. Younger people have grown up with unlimited access to explanation. And even if we didn't get an explanation growing up and starting in our career, that's no longer something that really works. So let's explain why that's so important if we're going to keep that policy in place for everyone. But let's also, on the flip side, be open to policies that have served their purpose and maybe no longer are serving us well, and be open to changing those if we find out they are disproportionately affecting certain parts of our workplace. And the last example I'll give might be something around benefits. We've talked about childcare benefits, and this varies by culture, of course, but we are now seeing in the US a lot of attention on grandparent leave, elder care support, menopause benefits. And for younger people, they're asking for more mental health support. They're asking for emergency fund access, even pet care insurance I've seen come up a lot. So I would say just be open to the fact that it may not be a one size fits all. It may be, are we meeting the needs of our age diverse population?
Thank you so much, Megan. I think as hospital leaders, most of us, the attendees that are in the call, it's very important to look at these policies even at the institutional level. Some of them, most policies might be beyond an institution, but how you implement them in an institution needs to be specific to your environment. So you can actually tweak these policies to suit your environment to ensure that you keep this diversity in terms of age. I think I'm just gonna end it with just asking each and every one of us, and also just trying to answer the questions in the chat. I've been looking at the questions. We've got a question from Gail. Gail wanted to know, why does paying attention to generations when putting teams together produce better outcomes? I think I'll leave this question, I'll give it to Erin. But then, Erin, you'll be the last person to give, when you give your one sentence, I just want each and every one of you, and as panel members, to just give me in one sentence, if you were to advise one of the hospital leaders, what advice would you give them? Just in one sentence, what advice would you give a hospital leader to ensure that they create an age-inclusive environment? In one sentence, Miguel. I'll start with Miguel and Megan, and I'll end with Erin. And Erin, please, if you could kindly respond to Gail's question.
Yeah, just quickly responding to Gail's question. It's not just about age. It's about making sure that you have a team diverse enough to reduce blind spots, and age is part of it. So I recommend I use a board like a matrix, we don't have enough time to really go into it, but it's kind of like deciding what you want on your team. What do you need for diversity of age, gender, region, race, any of the things that you want to, any of the viewpoints that you want to have on your team. Just make yourself a little chart and say who on the team has these things, have people self-identify, and have them tell you where they're bringing their voice from, to make sure that you are not missing something. And that is the thing that is so important about having diverse teams. And research shows that diverse teams perform better, and age is just part of it. So that's why I think.
Age is one of the diverse boxes. Thank you so much. Thank you. Just one sentence, Miguel, one advice you'd give to a hospital leader?
Giving an advice to a hospital leader, being an hospital leader is giving advice to myself.
Yes.
No, but what I think it's the most important advice would be to lead by example. You have to respect everybody independently of the difference they have. So you have to respect them all. You have to communicate, taking their difference in account, and involving them in the purpose of the organization and making them feel that they are important in the team, regardless
I
color, regardless age, regardless everything.
Thank you. Respect everyone. That's the advice. Thank you. I'm taking that advice as one of the hospital leaders. Thanks, Megan. I'll move to Megan. One advice to a hospital leader.
I would say proactively create opportunities for people to work on important things across generations, whether that's a mutual mentoring opportunity where we're transferring knowledge in a more structured way because our organization has created that opportunity for us, or just as Erin said, intentionally creating teams where we're making sure all generations' voices are welcomed and encouraged. We don't normally work with people across age and generation as much as we do people close in age to us. So how can we proactively create opportunities for that?
Thank you. Creating opportunities for everyone, despite their age. Thank you, Megan. And Erin, the one advice you'd give to a hospital leader?
I would say that we have not started learning about ageism enough as an entire world. It's still a new conversation. And research on bias shows that it takes 100 years to move the needle even a little bit. So we're just starting and we have a long way to go. And my advice for hospital leaders and for everybody is we have to start with ourselves because there's a lot of there's a lot of mental block that we have. We're not able to be as effective as we could be. And we can't build age diverse teams if we're leading from an ageist perspective. The World Health Organization, again, is a wonderful place to go. They have a lot of tools and resources. There is an implicit bias test that's based at Harvard that is wonderful. It looks at a lot of different biases, but there's one on ageism there that everybody can take. I recommend that everybody just Google it, Harvard implicit bias test. It will show you where your blind spots are in terms of ageism. And also you'll all be receiving a link for a survey on that the World Health Organization has put together on it's an ageism survey, and it surveys individuals in groups, individuals who are parts of a certain group. And I put one together for this group here at the people who are at this webinar today. And it will give us an idea about how everybody in this group feels about their own age and about ageism within themselves. So it's a good place to start. And starting with ourselves helps us to help other people on our team to move forward in a more age-inclusive environment.
Oh, great. Thanks, Erin. So starting with ourselves. That's
Yeah.
the advice I'm taking as a hospital leader. Thank you so much to everyone and all this advice that you gave and the knowledge and learning. I mean, we started with just defining what we mean by this intergenerational workforce bias or the age bias. So we started with that and we looked at the positives, we looked at the consequences, then we dwelled on how we can close the gap or bridge the gap. And finally, we looked at the future and possibilities and things that we can implement and advices to give to leaders. Thank you so much to all the panelists. I don't see any other questions. I do see that there's something that Ilona shared in the chat. Ilona, you want to come in?
Thank you, Mantra. I've shared the survey that Erin referred to in the chat, and I'll also be sending it out to everybody who registered and was unable to attend at the last minute. But just to thank you all for the wonderful discussion, such a rich discussion today. And I love that the different viewpoints represented and how we've come out with some really great suggestions for hospital leaders. If you would like to get in touch with any of our speakers, then let me know, any introductions. I just want to thank Dr. Mantra for leading this discussion so expertly. Thank you. This is our final Women in Leadership webinar before the World Hospital Congress, which is our big in-person event every year. And it will be held here in Geneva from the 10th to the 12th of November. And we really hope to see some of you there. Mantra will be there at our workshop talking more about another initiative, which is the IHF Mentoring Circles initiative. And that supports leaders of all ages. And I think we're going to really take some of this knowledge to that initiative and look at a bit more into this this area of age-related bias, because I think the mentoring circles is a great place to do that. So thank you, Megan, thank you, Dr. Mantra, thank you, Erin, and thank you, Miguel, for a wonderful conversation. If anyone needs any more information, please just contact me directly. But otherwise, we'll leave it there and say goodbye. Thank you so much.